Hello dear students, welcome back to my YouTube channel Physiology Learning. So we are continuing with our ECG series. In this video we are going to do the axis calculation. In the previous video we analyzed how to calculate the heart rate, and in this video we are going to analyze the axis. And axis analysis will help us to diagnose some of the abnormal conditions in the ECG. So let's get to the topic. So first, axis calculation. So axis calculation, what do you understand by axis calculation is, this will help us to determine the position of the heart. So this is going to tell about the position of the heart. So depending upon the position of the heart, some of the diagnosis can be made. For example, I'll tell you one example. Suppose the normal direction of the heart is like this. And all of us know the firing of the SI node goes and it goes in this direction. So basically most of our heart is situated in this direction and the axis of the heart goes in this. So axis of the heart means the major vector, the direction of the major vector. So the direction of the major vector is called as the axis. So we are going to find out where is the exact position of the heart depending upon this direction of the major vector. And direction of the major vector means all of us know that in ECG the major vector is the R wave. The R wave is the major vector. And in a normal person, the ventricles, there are two ventricles, the right and left ventricles. And both of them, whenever they are depolarizing, they are going to produce instantaneous vector, which we have already seen it. And once they produce so many instantaneous vector, and finally the end result will be formed as a mean vector. This mean vector will give us the direction. And all of us know in a normal person, the left ventricular musculature is more than the right ventricle. So obviously the mean vector will be directed towards the left ventricle. So the axis of the heart will be lying somewhere in this position. So normal axis we will see from which angle to which angle. Suppose if you are drawing a quadrant, and most of the times the heart's position is in this quadrant. So this quadrant is considered as a normal axis. Just in case, I will give you an example for a right ventricular hypertrophy. So in a subject who is having a right ventricular hypertrophy, the right side musculature has grown bigger now than the left side musculature. So what will happen to this mean vector? The mean vector obviously will be directed towards the right ventricle now. So this will be the mean vector because the musculature is more in this condition. So this is an abnormal condition I am talking about, that is right ventricular hypertrophy. So the mean vector, instead of going in this direction, now it is being pulled towards this direction. Suppose the right ventricle is getting enlarged. So instead of going like this, the mean vector will start moving towards like this. Can we identify this in the ECG? Yes, we can identify this in the ECG. Without looking at the echocardiogram or anything, we can just identify it in the ECG, and sometimes we will be able to comment whether the patient is having right ventricular hypertrophy or a left ventricular hypertrophy. So that is the importance and the purpose of the axis. So to understand the purpose of the axis, we have to know what is the normal direction of the leads, especially the augmented and the limb leads. So all of us know the lead one is attached between the right arm and the left arm. So that is the lead one's direction. So the lead one's direction is going in this direction and it is almost in 0 degrees. Whereas the next limb lead, the lead 2's direction is in 60 degrees. Because in the Enthoven's triangle, we already saw like this. This is lead 1, this is 2, and this is lead 3. So this is the lead 2's direction, this is lead 1's direction, and lead 3's direction. And lead 3, as you can see here, it is around 120 degrees. Then the augmented leads, the AVF is the foot, which is in 90 degrees. Then the AVL, which is in the left arm, which is around minus 30 degrees. Then AVR, which is on this side, which is around 210 degrees. So these are the three different directional leads, three different directions we have it. And do I need to focus on all the leads to identify the axis? The answer is no. We just need at 2 leads, sometimes more than 2, that is 3 leads. That is sufficient to identify where the heart is exactly placed. So the basic requirement is 2 leads. So coming to the normal value, so we are going to take 2 leads, that is the lead 1 and lead AVF. These are the 2 leads which we are going to consider. Why are we considering these 2 leads, sir? Why? Because whenever you are putting a vector, if I have a proper direction which is perpendicular, that is 0 degrees and 90 degrees, it is easier for us to understand. Can I take any other two leads? Yes, you can take other two leads also, but the easiest way to do it is with the lead 1 and lead AVF. That's why we are going with the ECG. Then what is the normal axis of an individual? I told you it is mostly lying in this quadrant, but it can extend a little more also. So the normal axis is from minus 30 degrees till 110 degrees or 100 degrees. Some books have given 90, some books have given 100, some books have given 110. So the normal axis in an individual is, normal axis means normal direction of the heart in an individual is minus 30 degrees to plus 110. We will take the extreme values to plus 110. So this is the normal axis. Now how are we going to calculate axis using an ECG? Now I told you we just need two leads. Sometimes for some conditions we have to add on one more lead. First we will analyze this. So first basically I need two leads, and lead 1 and AVF is our choice, and this method is also called as quadrant method. So in maths you must have seen the drawing various quadrants and merging them in a Venn diagram. Suppose if I ask you, there are two diagrams like this, and if I start shading here, and in another diagram if I start shading here, you can easily tell me which is the common area. So that is the same principle we are going to apply. So basically what we are trying to do, we are trying to take two cameras or the two leads and trying to picture the heart from two different angles and trying to locate it in the position. So for this we will consider lead 1 and lead AVF. So how do we interpret it? Suppose the lead 1, there are two possible options. The lead 1 can show a positive wave, or the lead 1 can show a negative deflection. So the lead 1 is going like this in between the right arm and the left arm. So this is the lead 1, and which is the positive side in the right arm and left arm. The left arm is the positive side, so we are going to put a plus here, and the right arm is going to be negative. So if the read 1 recording is showing positive, what does it mean? The QRS deflection is moving towards this left arm. Why? Because left arm we have placed it positive. If the QRS complex, which is positive wave, which is moving towards this positive direction, it is going to give a positive deflection. So we have got the deflection already. The deflection is positive. So where does this deflection lie? So we are trying to divide the lead into half. So basically what we are going to do, whichever lead we are taking, we are going to draw a perpendicular to that lead. Now tell me, among this A and B side, which is going to be positive? Because the positive lead is here, this half we will consider it as positive. So in the above diagram, if the lead is showing positive, this is the area where the QRS complex will lie, because it is going towards the positive terminal. So first what did we do? We took a lead 1 and then we drew a perpendicular, and then we started analyzing which area is positive, which area is negative. In this condition, this area, the shaded area, will be positive QRS, the other side will be a negative QRS. So the other side will be a negative QRS. So in a similar manner, if I do it for the lead AVF is going down like this. So which is the positive side for lead AVF? The below area. The below area AVF will be positive. So what is the first thing we have to do? We have to draw a perpendicular to it. And whenever it is recording a positive, so here it is positive, so this half is considered positive. The other side will be considered as negative. So as you can see here, this is the positive QRS and the negative QRS. It might be little confusing to begin with, but do not worry, stay till the end. You will find an easy mnemonic to remember it, but it is always better to remember it conceptually, then go and analyze, have a mnemonics for it. So this is how we are going to shade it. So now we have understood which is positive for a lead 1 and which is positive in an AVF lead. Now let's start analyzing it. So what are the combinations that we can get it? Either both the leads could be positive, or both the leads could be negative, or one lead is positive, another lead is negative, or the other way, one lead is negative and the other lead is positive. Now let's try to understand with this quadrant method. So basically we have 4 quadrants. So there are some exceptions also, like minus 30 is there, but still we will try to analyze. So this was our normal axis. And when the right ventricle is getting hypertrophied, it is being pulled towards the right side. So this area, if it falls, this quadrant, if it falls, we can call it right axis deviation. So that is right axis deviation. And if it is If the left ventricle is being hypertrophied, the axis will be pulled more towards this side, like more towards the upper side than the normal axis. So that will be left axis deviation. And this area, which is sometimes it is a very rare condition, sometimes it can fall over this area because of abnormal depolarizations. It is called as extreme axis deviation. So depending upon the four quadrant, wherever it is lying, we are going to comment on whether it is right axis deviation, left axis deviation, or an extreme axis deviation. So this quadrant was our normal axis. Now let's try to analyze lead 1 and AVF. So in the first scenario, lead 1 is positive. So here I have mentioned lead 1. In lead 1, what we did a perpendicular, so already the perpendicular is drawn. So I will be shading the area whichever is positive. So this half is going to be positive when lead 1 is going to be positive. Coming to the AVF, it is going downwards, so the bottom half is positive. So this half is positive. So what is the common area between these two diagrams? The common area is this area. So when both the leads are positive, where is the common area lying? The common area is lying in the normal axis. So the common area is lying in the normal axis. Now coming to the other condition, when both are negative. Now the second case scenario, that is when both are negative. When the lead 1 is negative, this half we will be shading it. So it is the opposite of the previous condition. So this half we will be shading it. And AVF is also negative. So in this example, lead 1 is also negative, AVF is also negative. So AVF negative will be this above area. If you merge the common area between these two leads, we will get here. So what did I tell you? This axis is nothing but our extreme axis deviation. Extreme axis deviation. So now we have two things. One is when both the leads are positive, it is normal axis. When both the leads are negative, it is extreme axis deviation. Now coming to the third scenario. In third scenario, lead 1 is positive. So which half I will shade? I will be shading this right half. And lead AVF is negative. Negative means we are going to shade this half. Lead AVF, the above half is negative. So what is the common area? The common area which is coming is nothing but our left axis deviation area. So this is nothing but LAD, left axis deviation. When lead 1 is positive and lead AVF is negative, we will have a left axis deviation. Then coming to the last scenario, when lead 1 is negative, so this side, and lead AVF is positive, so this area. So if you go and mark the common area, that is nothing but a right axis deviation. So this is nothing but our right axis deviation. So there were four possibilities and four of them are occupying each quadrant. Now you might think these diagrams are a little complicated. It will take a lot of time to analyze in a patient. It is not going to be like that because now we are going to understand the shortcut. So once you have analyzed this Venn diagram method, you can pause the video, go back and have a look at it again and you will get the concept better. So now the end result is very, very simple. What you have to do, you have to just look at two leads. One is the lead 1 and lead AVF. When both are positive, the answer is simple, that is normal axis. When both are negative, extreme conditions, that is extreme axis deviation. When lead 1 is positive and lead AVF is negative, you can consider these two as couples and they look like they are leaving away from each other. It's like they are getting separated and going away from each other. So you can remember the mnemonic as leaving away. So this leaving away, you can take the L and remember as left axis deviation. Now this couple are close to each other and this looks like they are going to kiss each other. So this is in a right position. So this is in a right position. So they are in a right way to join each other. So right position, you can remember it as right axis deviation. So the entire end result or the summary is very, very simple. So you are just going to look at the lead 1 and AVF. When you look at the lead 1 and AVF, both are positive, normal axis. Both are negative, extreme axis deviation. When they are looking like they are leaving away from each other, it is a left axis deviation. When they are trying to be in the right position, it is a right axis deviation. So in a left axis deviation up to minus 30 degrees is normal. So what we can do is we can add one more lead to make it more convincing. So what you can do is because in the left axis area, quadrant area, till minus 30 it is normal. So till minus 30 it is considered as normal axis, and this part is only considered as left axis deviation, because normal axis, I told you, it extends a little beyond also. That's why sometimes we will be needing more than 2 leads, which I have already told you. So now what we are going to do is we are going to look at lead 2 also. So when you look at lead 2 and lead 2 is positive, then again still it is within the normal axis. When lead 2 is negative, it will be in the left axis deviation. So for left axis deviation, we are going to go one more step ahead and do the lead 2 also. And lead 2 shading also, if you do, you can understand, like lead 2 is coming like this. So when you draw a perpendicular to it and start shading the area, this half will be positive. If it is positive, it will come in the normal axis region. That is why we are considering one more lead. I am not going to explain the details of it. The same Venn diagram method, when you apply one more lead, you can get it. So this is how we are going to calculate the axis. And once you calculate the axis, if they are looking like living away from each other, it is a left axis deviation. So it could be a left ventricular hypertrophy. So the right axis deviation could be a right ventricular hypertrophy. Why it has deviated to the right axis? Because now the musculature on the right side has become more and more. So now I will give you a homework. You can put in the comment section, drop it in the comment section by analyzing the axis of this ECG sample which I have given. So as you can see here, I will highlight it and show. So in the lead 1, it looks the QRS complex is downwards. In the lead AVF, the QRS complex is upwards. So once you get an ECG, you just have to look at 2 leads and now you know the answer, because I have already told you. You can drop it in the comment section what is the axis of this particular ECG. Thank you for watching the video. Stay tuned for more such videos. Subscribe to the channel and we will see you in the next video. Thank you so much.